Hello everyone! Today I'm going to introduce to you the various diagnostic tests for dengue fever. Understanding the science behind each dengue test helps us to detect dengue infection during the acute stage. However, the interpretation of diagnostic results should be done in correlation with clinical context. Diagnostic tests include point-of-care testing such as dengue NS1 antigen test and rapid combo tests which include NS1 antigen and dengue IgM and IgG antibodies. Both antigen and serological tests are commonly used to diagnose dengue infections. These tests include the NS1 antigen test, dengue antibody detection tests include IgM and IgG ELISA. Other laboratory tests include dengue genome detection assay, which is real-time RT-PCR, and dengue viral isolation assay. Usually, different patterns of antibody response are seen in primary dengue infection as compared to secondary dengue infection. Detection of significant elevation of IgG antibodies to dengue virus by ELISA is very useful for identification of secondary dengue infections. Rapid combo tests are assays that can detect the presence of virus as well as antibodies simultaneously. Generally, rapid combo tests can be read within 15 to 20 minutes. However, it is important that these tests has to be read according to the manufacturer's recommendation in the product insert. Reading the test too late gives false results. These tests have a longer detection window as they can detect both the virus and antibodies, hence reducing the possibility of false negative results. These tests are useful during the early phase of onset, where there is viremia, as well as at the later stage when antibodies against dengue begin to rise. Non-structural protein 1, or NS1 antigen, is a highly conserved glycoprotein that seems to be essential for virus viability. Secretion of the NS1 protein is a hallmark of flavivirus infecting mammalian cells and can be found in dengue infection as well as in yellow fever and West Nile virus infection. The detection rate is much better in acute sera of primary infection when compared to acute sera of secondary infection. The sensitivity of NS1 antigen detection drops from day 4 to 5 of illness onwards and usually becomes undetectable in the convalescence period. The presence of NS1 detection after day 5 may predict severe dengue. The IgM capture enzyme-linked immunosorbent assay, or ELISA, is the most widely used serological test. The antibody titer is significantly higher in primary infections compared to secondary infection. Once the IgM is detectable, it rises quickly and peaks at around 2 weeks after the onset of symptoms, and it wanes to undetectable levels by 90 days. In primary dengue infection, anti-dengue IgM can be detected after 5 days of illness in approximately 80% of the cases. Almost 93 to 99% of the cases will have detectable IgM from day 6 through day 10. In the event of a negative IgM result, a repeat serum should be collected after 5 days. However, in secondary dengue infections, IgM was detected in among 78% of patients after day 7. IgM appears earlier or at the same time frame, but usually at lower titers compared to primary dengue infection. This is possibly due to the appearance of high levels of anti-dengue IgG before or sometimes simultaneously with IgM response. Thus, 28% of all secondary dengue infections were undiagnosed when only IgM was the only assay performed. In primary and secondary dengue infections, dengue IgG was detected in 100% of patients after day 7 since the onset of fever. Therefore, a repeat dengue IgG is recommended if dengue IgM is still negative after day 7 with negative IgG in the initial test sample. You should also take note that serological tests for dengue has been shown to cross-react with other flavivirus, such as Japanese encephalitis, non-flavivirus such as malaria, leptospirosis, toxoplasmosis, and syphilis, as well as connective tissue diseases such as rheumatoid arthritis. Dengue viral RNA detection is a molecular method that utilizes reagents that will target specific genome of the virus to enable amplification and detection of the target. The method is useful only during the viremic stage of the disease and can detect the viral RNA target up to 5 days after symptoms onset. This test is useful for determination of circulating dengue serotypes. Several limitations of RT-PCR includes costly and requires special temperature storage and fast transportation, and only available in a few centers with facilities and trained personnel. Dengue virus isolation is the gold standard as the presence of virus is indicative of infection. It is useful only during the viremic phase and can take up to 21 days for results. Successful virus isolation can be used to perform full genome of the dengue virus sequencing in order to identify dengue genotypes or mutations associated with viral virulence. As clinical diagnosis of dengue lacks specificity, a definitive diagnosis of dengue infection requires lab confirmation. There are many targets for lab confirmation of dengue, which have been discussed of every target and when to do after the onset of symptoms. This table summarizes the types of tests recommended for patients presented with clinical history and their interpretation. This also serves as a lab guideline for the clinicians who are managing dengue patients. Do consider repeating the video and taking some time to go through this table. Thank you for staying until the end. If you find this video helpful, do not forget to share and consider watching our other videos on dengue fever. See you next week.